नमस्ते बिटिया हमेशा खुश रहो बिटिया Today we are going to discuss with the disorders and tumors of the fallopian tube. Myself Dr. Arti, Associate Professor, Department of Pathology, JAYOTI VIDYAPEETH FHS University. We start our lecture with the salpingitis and PID, which is called pelvic inflammatory disease. Pelvic inflammatory disease, by definition, it is a clinical syndrome characterized by signs and symptoms of ascending infection beginning in the vulva and vagina and spreading through the entire genital tract. Although ascending route of the infection is most common mode of the spread, PID may occur following abortion and purpurium with use of intrauterine contraceptive devices or from local intra-abdominal infections such as appendicitis and with peritonitis. In addition, hematogenous spread may occur, though this route is more common in the pathogenesis of tuberculosis. Patients generally complain of lower abdominal and pelvic pain, which is often bilateral, dysmenorrhea, menstrual abnormalities, and fever with tachycardia. Long-standing chronic PID may lead to infertility and adhesion between the small intestine and pelvic organ. The general examination shows the fallopian tubes are invariably involved bilaterally and the distal end is blocked by inflammatory exudate and the lumina are dilated. There may be formation of loculated tubo-ovarian abscess involving the tube, ovary, broad ligament and adjacent part of the uterus. Microscopic examination appearance vary with the duration. First, the process being with acute salpingitis characterized by edema and intense acute inflammatory infiltrate of neutrophils involving the tubal mucosa as well as wall. And the second is the purulent process may extend to involve tube as well as ovary causing salpingo-oophorytis and forming tubo-ovarian abscess. Third, the escape of purulent exudate into the peritoneal cavity produces pelvic peritonitis and pelvic abscess. Pyosalpinx is distension of the fallopian tube with pus due to occluded fimbrial end. End result of pyosalpinx after reabsorption of purulent exudate is hydrosalpinx, in which the tube is thin-walled, dilated, and filled with clear watery fluid. Acute salpingitis may resolve with treatment, but some cases pass into chronic salpingitis with infiltrate of polymorph lymphocyte plasma cell in fibrosis. In tubercular salpingitis is almost always secondary to focus elsewhere in the body. The tubercle bacilli reach the tube most commonly by hemorrhages by hematogenous route, generally from the lung, but occasionally from the urinary tract or abdominal cavity. Tubal tuberculosis is always present when there is a tuberculosis of other female genital organs such as endometrium, cervix, lower genital tract. Concomitant involvement of the endometrium is present in about 80% cases. If affects more commonly young women in their active reproductive life, and the most common complaint is infertility. General examination, the tube is dilated and contains purulent exudate, though the fimbrial end is generally patent. The tubal peritoneum as well as the peritoneum in general is studded with yellowish tubercle. Microscopic examination, typical caseating granulomas, and chronic inflammation are identified in the tubal serosa, muscularis, and mucosa. There is one thing other that is ectopic tubal pregnancy. In ectopic tubal pregnancy, it is used for implantation of the fertilized ovum in the tube. Though ectopic pregnancy may rarely occur in the uterine horn, cornua, ovary, abdominal cavity. Tubal pregnancy is by far the most common form of ectopic gestation. Several factors which predispose to ectopic tubal pregnancy are the PID, previous tubal surgery, use of IUCD, congenital abnormalities of the female genital tract. Ectopic tubal pregnancy is potentially hazardous problem because of rupture, which is followed by intraperitoneal hemorrhage. Tumors and tumor-like lesions also there in the fallopian tube. They are very rare. Relatively more common are tumor-like conditions such as hydatid of the Morgagni or per-ovarian cysts, which are unilocular, thin-walled cysts hanging from the tubal fimbriae. Rare tumors include adenomatoid tumors, leiomyomas, teratomas, adenocarcinomas, choriocarcinoma, of all of which are similar in morphology to such tumor elsewhere in the body. This is my reference. I hope you enjoyed this session. If any query, mention it in comment box. Thank you so much. Bye bye.